Hi guys, my name is Dr. Puneet Gupta. I have been an aesthetic physician for over 13 years now, and my main area of specialty is body sculpting and fat removal using minimally invasive techniques of liposuction under tumescent local anesthesia, and mainly specializing now in treating the condition of lipedema. I see so many ladies coming in every week, and some have had bad experiences already, and some have managed to do the right research and still researching. So we decided to put together this little brief guide to cover up the worst 8 mistakes some of these lipedema girls have made over the years, and how we can avoid them and avoid unnecessary grief and trauma to this already dreadful condition that we finding it hard to contain. So let's look into some of those areas one by one and see what you feel. Number one thing is always do enough of background research. A lot of the times I've seen a lot of patients fallen for false advertisements, false claims, not done enough research, just got carried away with an advertisement campaign and ended up in trouble. So always do your background research. Yes, Google is there to answer most of your questions, but don't believe everything that you read online. The way to utilize that tool is to know what questions you should be asking in a consultation. So use the online resources and your background research to know what you should be discussing with your doctor in a consultation, so you have a better understanding of your condition and the options available to you. Number two, the influence of social media that we all living in this world of. You got to be very careful. Yes, it's a great tool to know what's going around in the world, but at the same time, you are also vulnerable to get misinformed and get carried away with the pictures and footings that you see. And not all of them would be true to their cause. So always be very cautious in approaching different social media platforms, and always be mindful of the fact that no two persons are the same. There will always be individual variations. So if one person had a bad result, that doesn't mean everybody will have a bad result, and vice versa. If one person has a spectacular result, then it may not happen to you. It all depends upon your own makeup, skin quality, areas you're getting treated. But the take-home message is use the social media to be aware of what's going on, what's out there, but make sure you explore each and every option, doctor, clinic, before you make your final decision. Number three, the most common mistake I see being made by most patients is not understanding the whole science behind liposuction. Now, I'm not expecting you to be an expert in that, but what I see is some bits and pieces information read on the internet and then misinterpreting it and not knowing what those things mean. So make use of that research correctly. Water-assisted liposuction possibly is not the same thing as tumescent liposuction, for example, but I see girls getting confused very easily, and they think when they're going for one, they're having the other one done. So again, my take-home message here is understand it as best as you can, but make a note of your questions, take them at the consultation, discuss it with your doctor, so you understand it better, you understand the options better, and when you turn up on the day of your procedures, you know exactly what's going to happen with your body, with the recovery and the end result that you're aiming for. Fourth common mistake that I see is most patients don't do enough research about the clinic or the doctor they're going to in terms of their credibility. You must check the doctors or the clinic's credentials, that they are registered with the appropriate bodies, appropriate regulators. It is a very common practice for doctors flying in from abroad, renting services, renting rooms, get the treatment done, and then the patients are left on their own. So you must make sure you go into a CQC registered premises. One best way to follow that advice is always pay into the account or a bank account, or pay to a company the name which is registered with CQC. So if a doctor is asking for a payment and the name is not registered on the CQC website, then possibly you may have issues there. Who bears the overall responsibility for that treatment? So you must take due care in checking the credentials and registration of any doctor or clinic you're heading to for a proposed treatment. Fifth commonly asked question and poorly understood point is about the safety of liposuction. A lot of patients I see, they say, I don't want traditional liposuction, I want the newer methods, but what they forget to understand is everything comes down to safety. If traditional liposuction is done in the right guidelines, it is as safe as any of the modern day liposuction procedures. So safety is one element that you must not forget. And what I mean by safety is the amount that should be removed in a single session with liposuction. Don't forget, with the modern day liposuction procedures, you're not staying in hospitals for 3, 4, 5 nights. You will be discharged on the day with your family member accompanying you home. So you need to be in a situation where you do not need any extra medical support. So you can be at home, recover on your own without the need for that medical assistance. And that is why it's very important that, especially in lipedema sufferers where a lot of fat has to be removed, that this is done in a phased manner with enough gap in between two procedures to recover, recoup from one session, be ready for the second, and do it in a phased manner so you remain safe at all times. Sixth point. Again, I see a lot of women contemplating this, and although I would not classify it as a mistake, but I think one has to be mindful of balancing the options whether to get it done in the UK versus abroad. Now, I firmly believe there are good doctors everywhere in the world, in every country, but what matters is the local guidelines, local standards, local accountability, and medical laws applicable to doctors. So you must consider all that firstly into account before you consider going abroad for any of these procedures. And not to mention the overall recovery period. So you got to weigh in, yes, you may find a place is cheaper than getting it done in the UK, but consider the cost of travel, consider the cost of staying over for a few weeks after the procedure, and in the end you will find out it will probably be even more, if not the same, as it getting it done in UK. So money is important, but I think what is more important is your safety and aftercare after these procedures in the comfort of your home, and not thinking about traveling and dealing within a rented accommodation or a hotel where there is no help at hand. Point number 7, choosing the right doctor or the clinic. I've already covered that, but yes, you need to ensure the person you're going to has got enough experience in dealing with the condition that you're heading for. More so relevant with lipedema, because you do not want to make the condition worse by going for aggressive instruments and aggressive techniques. If somebody has got a vaser cannula in and a vaser probe in to liquefy the fat, then it doesn't matter after that, even if he uses or she's using a fine bore instrument or a micro cannula, because the damage is done with a wide bore instrument in first place. So it's a combination of factors one has to think. I would very strongly suggest do your research based on patients' reviews. There is no useful tool than that to know exactly what's going on with different practices, different doctors, different clinics. Read through as many reviews as you can, and if you can't find good reviews or if you can't find enough reviews, stay away would be my suggestion. And the very last point that I want to cover and warn you about, always think of what happens if things go wrong. Where is the safety netting? Where is the accountability? And I think that's where a lot of the things that I've already covered will fall into place. Do your background research, do your research as the doctor, check the registration status of the clinics and the doctor, make sure the person you're going to is doing in a lawful manner, not just by hiring a theater in a registered clinic and taking your money and doing it, but where does the overall accountability lie in the end. So you must always think of it, whom you're going to approach and where you're going to approach should things go wrong. That's why it's important you head off to a clinic which is registered for, has got credibility with CQC, and certain safety standards have been met and you will be in safe hands. All the best.